Okay, so I sent this out to everyone, but we're going to do it again. You have it, yeah. Okay, so we're doing this case as an attempt on my part to, oh, I'm sorry, Karen. Excuse me. This is good for you too.
Okay.
In an attempt in an hour to go over some issues in health policy that I guess were not covered. And just so everybody knows, we're reformatting the courses next year, and there is a different person who's going to be teaching a course called Decision Making in Health Systems, I think. His name is Boaz Horab, and I think he's finishing his PhD with Manfred. He's a physician. And so he's very excited about doing this, and we're going to try to get him to talk about a little more health policy. In the meantime, because we got this feedback that you didn't have enough, I thought we would take this session and we would do this. And we're going to do it as essentially a case, and let's see how it goes. I've not done this before, so we'll just have to see how it works. All right? And because there are only 5 of you, Karen, you're going to be part of this. All right? You made the mistake of coming, okay? You should have gotten sick like everybody else,
Yeah,
okay? Many sick people today. Okay. All right. So, here's the breaking news. In a major research study, NIH investigators from the U.S. have clearly confirmed that a specific form of mango juice, when used in a concentrated form, taken on a daily basis, reduces stroke risk by 50% in individuals with high blood pressure. Okay? Let's just take a minute. Isabella, you're the most clinical person here now. Diego's gone. Okay. The other doctors are gone. Well, Karen is too. Karen is, but she's been in nursing longer than you have. So. Sure. So tell us what a stroke is.
Okay. A stroke is a condition in which there is infection in the brain and
infarction, not infection. Infarction.
Yeah. Shortage of blood supply in a particular part of the brain that affects the supply of the nervous system to a particular body part, and that part can be innervated. Stimulations can't reach that part because of the infection in the brain, and so the person is temporarily paralyzed. You can't move that part.
Right, and their paralysis could be permanent. Yeah, and the word is infarction. A myocardial infarction is a heart attack. It's the same, very similar event that occurs. Is stroke common or uncommon?
Very common.
Common, right? Very common. So, and what relationship is there between stroke and high blood pressure?
High,
right?
Yes.
Right? So, one of the major risk factors for stroke is high blood pressure. If you have high blood pressure, your risk of stroke goes up a lot. So, these people have in this, I've made this up, right? You know, we studied Greenland. And remember in Greenland, what did they have?
Banana juice, is it?
No, mango juice.
Was it banana juice?
Yes.
We had a case. It was there. You may not remember it, right? We had a case we had Schuster and we had Greenland, right? And, right? in Greenland had this tremendous good fortune that they had identified
And then the promise.
a land of promise, right? Right? And one of the reasons they had this promise was that they had this unique species of mango that they believed would reduce the risk of stroke. So now I've taken that case, and we now have proof that this mango juice reduces stroke risk dramatically. Right? So now the science has come out. This is a case discussion in health policy. So why are we talking about mango juice, this new research finding? I could make a story of a new pill, it doesn't matter, right? But why is this a class in health policy if what we're talking about is some new scientific discovery?
I mean, you need to think about how you're going to introduce it to people and why you need to introduce it and why you don't have to introduce it.
Right. So to assume that just because a scientific discovery has occurred, to assume that that will become the adopted practice in society is an assumption that you shouldn't make. In the real world, okay, when there is an interest to do something new in healthcare or in anything else, there's a whole public, in this case, health policy process, right? So let's say we wanted to give universal health care in America. What's that process? So I picked mango juice because it doesn't have any history. There's no arguing about it. This is new, clean, and easy to talk about, okay? And a couple of days ago, I sent you the chapter of a book, you don't have to read it. For Kingdom, who's particularly interested in this, I would, and Isabella, you should too. Okay. Wiser and wiser. Okay, right? And I think, yeah, you got it too, Karen. Okay. It's hard to read, but I just
It's kind of slanted.
yeah, that was me. I just put it on my copy machine at home, and okay. So the basis of that chapter serves as the basis for what we're going to do. Okay. Okay. So, first of all, let's ask the question, what's the problem? And we're looking at this from a health policy perspective, okay? So, if you're representing the government, you're representing the public, so you're sitting at home, you're reading a newspaper. It's Sunday morning, and you're sitting and having a cup of coffee and reading the newspaper. You're just a citizen of your country. You read an article about mango juice, and what is it? How does it relate to you?
It's something that you can easily do, like go out and buy to get your
No, for sure.
prevention out.
That's
Right, so-
the government rule to let you have it in low price. It's also like a policy that needs to be done. And
Okay, so very quickly, we're going to get into what the public wants of the government. The first thing is, what's the public's attitude toward this? Yeah, you're sitting and reading the paper, and you say,
I want to have
I want to have it. Okay, now who's going to say that? People with high blood pressure are going to say it.
Yes.
Okay, and who else is going to say it?
everyone to have.
No, not everybody. Wait, we'll get to that. The next group are going to be people who say, oh, my spouse has high blood pressure. Okay? Particularly the women. Men don't take care of themselves. Women take care of themselves and men, and they say, Kingdom, you need to go get some mango juice, right? So you think of your loved ones, or your aunt, or your uncle, or whoever it is. Okay? Now, let's go back to this. And Karen said everyone, and I'm saying no, not everyone. Who is not going to be interested in this?
Children,
Young people are going to say it's never going to happen to me.
or the one who have already spoken. It's too late
Yes,
for them.
but they're not going to think about it, okay? and other people who consider themselves healthy or just are uninformed. Okay? So, for example, in the United States today, approximately 40% of the people with high blood pressure don't know they have high blood pressure. Think about that. Most common significant health problem in the United States is high
it's the
blood
second
pressure.
one. It's the second deadly cause, high blood pressure. The first
Yeah.
is cancer.
Yeah.
All of them.
Right? 40% of the people who have high blood pressure don't know they have high blood pressure. And of the people who have high blood pressure and are treated, only about half of them are effectively treated. This is a profound public health problem. Okay? All right. So the public has a perspective. What's the government's perspective on this?
Regulation. No, so basically,
Go ahead.
you know, we need to do more tests. Is it safe? Efficacy, safety issues, where's the trial?
Okay, now, I'm going to step back, and I said government. There are actually different parts of government. Okay, so let's now take government and divide it up. So if you're a legislator, what you're going to read this and you're going to say what?
Where's the data?
They might want.
Where's the data's there now?
They might want more evidence than just one alone cannot. They might also want to know if this mango is found elsewhere and what have they done about it.
Okay, now, if you're an elected official, I'm not disagreeing with you, we're just, okay, if you're an elected official, you read this in the paper and you're gonna, and what are you gonna think?
I can promise this.
Hmm?
I can promise.
You can
this.
promise it, you're a politician. If you're elected,
Oh,
that
I love
means you're a
this.
politician. So if you resist it, people are gonna get mad at you. If you support it, people are gonna like you, except those who think it's a waste of money. They're not interested, okay? So as an elected official, you start thinking about,
How's this gonna benefit me?
yeah, and if you're a good elected official, you also say, how will it benefit the people who elected me? It's both.
If you're
Okay.
good.
Huh?
If you're good.
If you're good. That's how you should think, okay? And some of them do and some of them don't, okay? What if you're an employee of the government? You're hired to work for the government, and this is more what you guys were talking about.
You wanna look into the research and make sure that it is,
Is this real?
yeah.
Okay? Because what's going to happen if you work for some agency of the government, the elected official tomorrow is going to get a call, his or her office, from somebody in the public saying, I want this mango juice. Get it for me. How can we get it? We need to have it here in our country. And then the elected official is going to say, let me find out about this. And he or she is going to call up somebody in the government and say, Kingdom, is this real? Is this good? What should we do with it? Okay? Now we're going to get back to all of this as we go on with our policy issues. Okay? All right. What if you're the insurance company?
How can I make money off of this?
How can you what?
How can I make money off of this?
Right. Okay. Or how can you avoid losing money?
Right.
Okay?
Oh, that's true,
Yeah,
because people just start buying this
Yeah,
mango
they'll
juice, they're not going to need their insurance to go to the doctor, because if this does lower the risk by 50%, less people are gonna go in for drugs and won't need their insurance.
So it's a complicated issue with the insurance industry, right? So a good insurance company should say, this is great, because it will lower the costs of care.
But no, there's no good insurance.
But not in the United States. Okay. So on the other hand, what if the public turns around and says, this is medicine? This mango juice is medicine, and what does that mean to the insurance company?
Actually, they will buy. They will need to pay more money for
Right.
this drug.
So the cost of the insurance company will go up.
Yeah.
If 50% of people there are a lot of people with high blood pressure, if 50% if everybody with high blood pressure starts taking mango juice, what's in the insurance companies pay for it as a medicine, then that becomes a cost to the insurance industry, right? So they're going to have their perspective on this, okay? What about the professional organizations? So I'm picking here the European Cardiology Society. We can pick up this, the Israeli Cardiology Society in the U.S. Doesn't matter. So what are the cardiologists gonna say about this?
Take it, probably, they probably look back, and if it was sound evidence, they would 100% support it and try and get the message out there to doctors.
Right, so the professional organizations, professional healthcare organizations are gonna say this is an important new step, and we want to promote it, right? Now, technically,
It's like 7 years. Just to say it's not like the FDA said, let's say 5 or 7 years. to say
okay,
it's okay.
so Karen raises a very interesting point.
Because there are some.
From the moment of discovery,
The telomeride in the 50s, telomeride?
thalidomide.
Yeah.
Okay.
That is my.
So is it going to be safe?
Yeah.
That's a very important
Yeah.
question. Okay, let's just talk about this for a second.
But mango is not really whiskey. Maybe in diabetes.
It
I
should be
can't-
okay, but
Yeah.
you don't know, right?
Yeah.
That's a very good
That's-
point.
yeah.
Okay, now, from the time of a new scientific discovery until the time that it becomes the standard of care, how long does that take?
I know 7 years in Israel until it's safe. Like, no, it's less because now the technology, now you can do like some.
17 years is what they have published. Takes 17 years, so aspirin to reduce the risk of heart attack. The science came out 17 years before it became the standard. Not the recommended care, but actually the care that was delivered. Okay, long time. So if you're an advocate for change, you want to condense this, you want this done more quickly. And from a health policy perspective, that's part of what we're talking about here. Okay. All right. Okay. WHO, what's their position going to be on this?
Supporting it.
Yeah.
Again, coming
Yeah.
up with more studies.
Okay? Now, so before we go on, what have we identified with these 6 bulleted organizations?
But they all have different motivations and positions on this.
You would call them all stakeholders. That's the term you would use. Each of these organizations,
Okay.
each of these, the public is not an organization, but these are stakeholders. Okay? Right? That's the term that you would use. Okay? They each have a position, an opinion, a belief. And if you're doing public policy, you need to know who the stakeholders are. And you need to work with those stakeholders. Okay? That's the argument. All right.
So if you were the person who takes a public decision, then if these people we have analyzed, they are stakeholders, who then decide that let's do something?
Well, we're going to get to that.
Okay.
Okay? Right? Okay.
So what is the role of the stakeholders then?
What is the role of the stakeholders? First of all, well, what is the role?
The stakeholder?
Yeah.
Every stakeholder is different, there's not one singular role.
Is represent their interests and that of their constituents.
Right. Their role is to represent the interests of their constituents. That's what Kim said. Okay? Right? Now, how do you, let's go back to the public. How do you know what the public believes?
Public poll.
Public polls. Sure. Okay? So, what does America think of Donald Trump today? Well, 67% do not like him. It's down to 33% now. Okay? Right? Okay? How do you know that? Well, the polls. Okay? So that's where he stands in public opinion. And the public are also the voters, right? So in some of these things that correlates like government. Okay? All right. So here's our problem. Our problem is that we see the value of this new discovery. How should it be solved?
What be solved though?
Okay, I don't get the question.
Okay.
Is this a problem?
So it's not a problem per se, it's an issue. So we have a new discovery. The new discovery is that this special mango juice reduces stroke risk. How should we approach it? Maybe that's a better question to ask. How should we approach this?
Well, where is this mango juice coming from?
It's coming from Greenland. Little island, okay. Greenland, okay.
Is it only in Greenland?
Yep,
You have to import it out.
yep.
You have to make deals, yeah.
Make deals, maybe we do need to.
And how are we gonna make it so that, that we keep making this mango juice? We gotta keep making the mango juice. We drink it all and it's gone.
That's correct, okay. And so you're gonna have the agriculture industry in the United States and in other countries, not just the United States. The agriculture industry is gonna say, how can we make those mangoes? I bought a mango yesterday at the grocery store. I don't know where it's from, but they grow them here, I guess, okay? So somebody here is gonna wanna learn how to get that species of mango. Let me tell you what I'm getting at.
You can't grow them everywhere. And if you can only grow them in Greenland, what are you gonna do then?
I know, and that's gonna be an issue. What if you can only grow them in Greenland?
Certain species.
Yeah, okay. All right, now, let me go back to this, how should it be solved, okay? How do you deal with this? And the point that I want to make with it is, each of these stakeholders is going to have a different answer to that question, okay? Right? So, that's the first step in this policy process, is to recognize that each stakeholder, and I've given you these 6 examples. If we actually took the time, there are probably many more than 6 stakeholders in any healthcare issue, or any issue for that matter, okay? Okay, so the question is, and I think I got this from Weiser and Weiser, how should it be solved? In other words, what should we do? Okay, so the question is, what should we do? We know that there's this new discovery, this mango juice works. What should we do as a society to handle this, okay? And if it's a health policy issue, then it's going to involve government, right? Okay? So the first question is, should the solution, and the solution is going to be, everybody who needs it should get it, right? Okay? But let's think about that. Let's say very simply, okay, everybody who needs it should get it. Who's going to pay for it? How will it be distributed? Can we get it out of Greenland? Okay. Then
Is this gonna be like a different, like, it's not just like mango juice, like the one that you go buy at the store.
No, it's special stuff.
We're talking about
right.
Medicine.
It's from Greenland. Okay. Right. So now, Mesa, we're going to send you back to Jazir. What's the town that you did your practicum?
Oh, Jisr Azarka.
Say-
Azarka.
Okay. Okay. So you work in the Ministry of Health in Israel, and this is in your district, and you read this news, and what are you going to say? We need it. Okay. What are the people there going to say?
Like, why can't we just go buy mango juice from the store?
They're not going to know. They're not going to understand. They're not going to care because they're a minority population that's low socioeconomic status. They're not educated. And so you have a responsibility above and beyond the people living in the suburbs of Tel Aviv who are going to have read this and they're ready to run to the grocery store looking for it. Okay? Right? So all of a sudden you have new interest groups, new stakeholders representing special groups of people. Okay? Right? And so they are going to play into this, and when we ask what's the solution, you're going to represent them and you're going to say, we have to make sure we take care of this population, and we need an education program to teach them that this is important. You can't just put it on the shelves. Okay? Right? Okay.
So we also need to specifically know who will get these mangoes. It's not for everyone, of course.
Well, and that's a question, right? So if you don't have high blood pressure, should you be taking it? Okay? And the price is going to go like this, right? Okay? Because it's a limited commodity. So maybe you do want to make it a medicine and only have it prescribed. I don't know. Okay? All right, now, so that introduces the next question. We're going to want this distributed to people with high blood pressure. That's what we're going to say. Okay? Some people may object, the insurance companies may be suspicious, but generally speaking, this is something that we're going to want to do. do. Okay, so how should we see to it as government now that it gets to the people? Should we go through a regulatory process, a legislative process, or a court process?
Well, I think legislated, because I'm just thinking, a few steps back, you would have some sort of a white paper on it for public discussion before the promulgation of the actual act into law.
Right.
So, because I'm just thinking in terms of stakeholders, there's got to be some sort of a convener of stakeholders, because not all stakeholders have equal say,
Right.
waiting. So I'm just thinking the government would have some sort of a white paper for discussion, circulating, concurrent with the educational programs and things like that for the lay people as well. And then once you've done that, have a white paper presented by the government for discussion in public, and then that goes back to Parliament or any other legislative framework that exists in the country. So definitely, I don't think you can just jump into regulation. I don't think it's possible.
Okay, so let's go back and develop your point, and I want to just reinforce that. So what really happens, there's a discovery, and government often accepts the responsibility to convene the stakeholders.
Yes.
Okay, because government is serving the people, right? In a democracy, this is what happens. If you're not in a democracy, we're not talking there. This whole thing is talking about democracy.
Yeah,
If it's not a democracy, then you've got a whole different set of rules, okay? But this is a democracy that we're talking about, okay? So the government serves the people. And so when this news comes out, somebody in government is going to say, let's figure out what this story really is. So let's bring the stakeholders together and ask them to present their positions on this. Okay? Now, in your careers, there's a very good probability that you will become members of one of these stakeholder organizations. Okay? Or you're going to work for government, in which case you bring together stakeholder organizations, and you have to know all the different sides of this, all the different parts of it. Okay? Right? And Kingdom, you're right. What's going to happen is the government will bring together somehow or other these stakeholders, and they'll produce some kind of white paper or some process, some document or something that tries to get to the essence of this and says, what should we do? What should we in our country or our state or our society, what should we do? And then in the normal course of things, you're right, that gets submitted, and then there are comments from the stakeholders. Okay, is that a political process?
Yes, it is.
Sure it is. Sure it is.
It's
Because
also a lot of money and
Time consuming.
yeah.
yes, right, it's complicated, and there's money involved, okay, and there are people's lives involved, and you're going to have
Interest groups that also
Yes.
government can own.
right, and and here you're going to have, I don't have this listed exactly, but you're going to have the Stroke Survivors Association, and somebody's going to get up at this meeting, and they're going to say, how come it took you so long to find it, and I want it for my mother tomorrow? Okay, get it tomorrow. Where is it today? You're going to have all those constituents. Okay, now let's go through.
The question.
Yeah.
I'm thinking that's just a little bit back. When I read that paper about regulating, legislative, and other things, please can you tell
Yes,
me?
we're about to talk about that.
Okay.
Okay, so let's take our mango juice as an example. So let's say we've decided that we want everyone with high blood pressure to take the mango juice. Okay, who's going to actually make that decision, and how will it be carried out? So regulating it means that a government agency, the Ministry of Health, or maybe the Ministry of Agriculture, or somebody who releases this white paper, then states, this is a new regulation, that everyone with high blood pressure needs to take mango juice. You do it by a regulatory process. Okay? Let me give you a different example. Putting fluoride in water. Okay? I assume there's fluoride in the water here, right? Okay, right? It's good for teeth, right? How is it that there's fluoride is not a natural substance in the water? You put it in. Who decided to put it in?
Government.
Government through what process?